used to feel like physically sick before I went to clinic because I would always feel like I was being judged or like I was never really good enough because my results weren't that great before. But now that they're starting to get a bit better, I feel like they're acknowledging the fact that I can handle my diabetes and I can improve, and their appraisal is like motivating me to get better at it, and it's making me feel more confident within myself and my diabetes and my managing.
I feel sometimes that my consultant doesn't always appreciate the effort that I make when it comes to managing my diabetes, and that if they focus on the negatives rather than the positives, and it just sometimes makes me feel bad about myself.
Well, I feel like a lot of the time if you go to clinic they can focus a lot on the negative side of things. Encouragement, I think that would be a really, really good thing to kind of improve on.
One thing I would like to change about my clinic is I would like healthcare professionals to see me as a whole person and not just the numbers on a page.
One thing that could be improved in my clinic is my clinician to stop giving me instructions and to now start giving me options and to take my view rather than jumping to conclusions. And I feel that she doesn't value me as a person and my experiences when she asks me these same things.
I think that in my clinic I'm talked down to a lot, so I would say to them, talk to me, not at me, and that would just make me feel more respected, and I would respect my clinician more, my diabetic team more.
At my clinic, what I think could be improved is if the consultant would give you time to answer the question what he's asked. Sometimes I feel like he's just going through the motions.
It's good to have all the information right up front because it's handy in case, so you know all the sorts of risks that you're up to and like the dangers of all these sorts of complications with any of your medical equipment. And even though the doctors might feel like they're overburdening you the first chance that like they explain this stuff, it's really handy because it can basically save your life.
It's a lot of the time that they give me appointments that I can't attend. So if they had more flexibility, I would be able to attend it. And I think a lot of people would benefit if they had things like online booking. It would make it a lot more accessible for a lot of people.
Well, I'd like if they clarified whether I can actually bring someone along with me. My boyfriend's my main support in my life, and the fact that he basically isn't that involved, and basically he's just asking me how I got on.
Sometimes I can feel isolated as the only young person in the waiting rooms. I'd like it if appointment times could be broken down so there's a time slot specifically for young adults with diabetes.
I find when I go to appointments, my emotions aren't at their usual level and I'm feeling more anxious and I'm feeling more stressed. So I'd find it more helpful if when I enter the clinic I'm feeling more secure and I'm feeling welcomed in, and that my consultant can recognise and understand that my anxieties are higher.
And it's quite apparent that they've read over my notes, they know what to expect, and we can start a really good review, and it normally has a good outcome.
If I could change something about clinics, it would be that they took time to prepare for me going in to see them, knew who I was, said a wee friendly hiya and valued me as an individual. When we go to clinics, we like our consultants, as when we go in it's not all about diabetes, it's more of a general conversation like what we do in our spare time, and then we build up to like talking about our health and our diabetes.
But we would like to have been introduced to them in the children's clinic.
What works really well in my clinic is the fact how supportive they are with me using social media within the clinics. I've got a Facebook group which I use to connect with a lot of other young people, and my clinics have been so supportive in helping me find the young people to join the group. A really good thing about the group is the fact that it's got a lot more young people engaged in their clinics and speaking to other young people, which has been a really positive thing for them and their diabetes.
Well, in my clinic, when I go, the doctors and the nurses are always really friendly, and it just makes the experience a lot better, a lot easier for me, and I enjoy going.